If you're pregnant, you don't need to panic about every virus that you're exposed to. But there are a few infections that we take seriously because they can make newborns very sick. Following several unusually low rates during COVID years when transmission was suppressed, whooping cough resurged in 2024 as expected. Most cases occur in school-aged children, but infants under 6 months are at a higher risk of severe complications, including hospitalization and pneumonia. Whooping cough or pertussis vaccination during pregnancy has been shown to significantly reduce severe disease and hospitalization in young infants as the mother passes on protective antibodies before birth. Influenza during pregnancy is associated with a higher hospitalization risk for mothers, especially in the second and third trimester. And evidence shows that maternal vaccination reduces laboratory-confirmed influenza in babies under 6 months old. Respiratory syncytial virus in infants under 6 months can cause pneumonia, bronchiolitis, and breathing difficulty, and is one of the leading causes of hospitalization. And clinical trials showed significant reduction in severe lower respiratory tract disease in infants when given during pregnancy. Not every infection carries the same weight, and vaccination timing in pregnancy isn't random. It's time to maximize antibody transfer to the baby. The highest impact protection strategies in Australia are simple. Pertussis or whooping cough vaccine in every pregnancy, given between 20 to 32 weeks. This recommendation applies regardless of when your last pertussis vaccine was given. It's not just about protecting you, it's about boosting the maternal antibodies at the right time so that they can cross the placenta and protect your newborn in the first few months of life before they can complete their own vaccine schedule. Antibody levels wane over time, so timing in pregnancy matters more than the 5-year interval rule that we use outside of pregnancy. The next one is influenza vaccine. This can be given in any trimester. When you're vaccinated in pregnancy, you pass antibodies across the placenta, so your baby is born with protection for up to 6 months before they're eligible for their own influenza shot. Then RSV vaccine given at 28 weeks, because that's when the transfer of antibodies across the placenta becomes more efficient. More antibodies crossing over equals stronger early protection against severe RSV in the first few months of life. And the last is on-time infant immunization. Newborns are vulnerable as their immune system is still developing. The infant schedule at 6 weeks, 4 months, and 6 months is carefully timed to close that vulnerability window. Delays extend the period of susceptibility. And the good news? Each of these vaccines are funded under the National Immunisation Program, meaning your doctor can administer them for you during your pregnancy and you won't have to pay for the vaccine itself.